What happens when two of the most plugged in people in digital care team up to help you make sense of the chaos? Welcome to Control Plus Care. I'm Michelle.
And I'm Katie.
This is your weekly briefing on the most important digital care updates. We'll be unpacking what you need to know this week in under 30 minutes. But first, Katie, how are you?
Yeah, I'm good, thank you. I feel like winter is slowly settling in, though. I'm in the never-ending cycle of I refuse to turn on my heating this early in the year. But, other than that, how about you?
Well, I'm great because this week we won a National Cyber Award.
Yeah, we did.
So you've got yours in the
Congratulations to
background.
you.
I have still got to dig my new one out to go on
You
the
have to have it
shelf.
in the background. Mine
Yeah,
sits pride of place next to my miniature Jeff Goldblum cutout,
I can't think of a better place for it.
obviously.
So yeah, we were really pleased. And what a great event, like a who's who cyber across every industry. And we won the Not-for-Profit Awards, which is even nicer.
Yeah. Such a huge congratulations to you and all of the team. And everyone looked fantastic. If you haven't seen the photos of everybody in black tie, would look them up. It's, not like every day that we get to dress up like that.
I did get to wear my shiniest dress. I looked as shiny as the statue, unapologetically.
Fair.
Now, on to the news this week. And this has been a busy old week.
Yeah, absolutely bumper. Selecting what to talk about this week, really, really hard.
And we are absolutely not going to hit all of the stories that have come out this week. So please do bear with us. We've chosen the ones that we think are the most relevant, and anything that we've missed this week, hopefully we'll get to dip into next week. But I suspect this week's going to be just as busy because we are heading right into Cyber Awareness Month, the Care Show next week. We have got a lot going on.
Mm-hmm.
So my first story today is one that has actually really upset me. It's really gotten under my skin. For those of you that know, I run Better Security, Better Care, so I live my life in the world of cyber. And this week there was a story about how hackers had stolen children's names, pictures and addresses from a nursery organisation. It was 8,000 children's identification stolen. And not only did they then try and extort the company, they went directly to the parents and tried to extort them as well. And it just, like, I'm not saying hackers are good guys, but it just felt that much worse and that much seedier than the incidents, where I can kind of get the rationale of, I'm going to hit a big company because they've got the money. But to attack children's data, data that they have no control over whether that's in the system or not. Ultimately their parents are the ones that have given permission for that data. So, there's that whole like data sovereignty of children straight away. And then to really go after parents who are absolutely without power to do anything about this. This story was so upsetting to me. I think because we deal with some of society's most vulnerable people in care, the other group are children.
I think it's a really upsetting one. I also just was blown away at how brazen the hackers were with everything. So the hackers were the ones who approached the media about this, from my understanding. They openly admitted that they had done this for money. And that's what they were doing it for, sort of. And, you've already said that hackers aren't good people. But to just come out and say it up front, no, we specifically targeted this nursery. With children's information. They put the children's photos online on the dark net. And okay, these are appropriate photos. They're just ones that the school uses to be able to, like, on a school child's file. And then to go to the media and say that they've done it just blows my mind.
It was awful. And the BBC spoke to the hackers directly and kind of were like, let's get your comments. And the comment was just egregious. They said, we weren't asking for an enormous amount and we deserve some compensation for our pen test. And there was just like an arrogance. And so obviously we know a lot of people who work on the ethical side of hacking. You'll have all met Cyber Sam. And the people that I've spoken to, and it was the talk of the Care Awards this week, were like, those who've been hackers before they moved over to the better cyber, like, we would never have done this. This is, whilst there's not a code, there's a general principle of if you're in it just for money, then you go where the most money is, not where the most vulnerability is, you know? So it's really upsetting. I think it's a sign that the rules that we thought everyone was playing by, they're not playing by.
Yeah.
And that more important than ever is how we start to prevent these attacks and, you know, ensure that our cyber resilience is up to scratch.
Yeah, definitely. Because, I mean, wasn't there a thing, I think during the pandemic, there were several sort of criminal hacking gangs who actually explicitly said that they would not be targeting healthcare
Mm.
systems, software, anything like that, because the pandemic was so bad they didn't want to be adding additional stress. And I mean, not everybody, honestly, but there seemed to be some kind of code
Well,
almost
it's,
there, which
I
is
mean,
gone.
obviously I'm not an international criminal
No,
that
no.
we know of. No, I'm
Hmm.
not. But if I were an international criminal, I'd
Yeah.
be thinking easy target, big money, not let's steal 8,000 children's worth of data and then contact their individual parents. There's something really pernicious about that. That's just really awful. That isn't about just getting the most money. That's about causing the most disruption.
Yeah, it absolutely is.
So
And it seems like a lot of admin as well.
maybe they've automated the systems.
Oh.
Cyber criminals on an efficiency drive. I hate
Well,
it so
Cyber
much.
Sam did tell us that apparently there is a workforce shortage in
Yeah,
cybercrime. So, got to find those efficiency savings somewhere.
I'm just waiting for the bursary programs to start.
Oh, God. Internships, obviously. Should we have,
Paid. It's not just the middle class criminals. We want working class people to be able to move into this industry too.
yeah, it'll be a commission first sort of bursary scheme, I assume.
We are not pro
No,
cyber criminals.
obviously not. No, it's a really awful story. I think we just have to find some way of bringing
Yeah.
levity to it. Should we have a more
Yeah, let's move
upbeat
on to your next
a
story.
different one? So my story is completely different tack. And this is kind of huge news, I think. So basically, it's a report from the BBC about how now half of all adults in the UK pay on mobile frequently. So more often than paying on a debit card or anything, over half are often using a mobile phone to make payments, which I'm kind of shocked about in two ways. One, because I was very slow to adopt the mobile payment app. It was very much something my friends laughed at me about for not getting on board with sooner. But also because all of my friends laughed at me, I just assumed it was way more than 50% of adults who were using it. I thought I was
Casey's still
like,
trying to pay into blooms. She's
I
like,
know. A
how many
check?
shillings
Do you
is
take
it?
checks? Anyway, so the data obviously really fascinating about this. You would expect, so it's 78% of 16 to 24-year-olds regularly use mobile payments. Sure, yep, wasn't aware that 16 to 24-year-olds even carried wallets or anything anymore.
No.
So yeah, great. But I think it gets interesting because while the percentage goes down for older demographics, it has been increasing year on year regardless. So now a fifth, so 19% of those aged 65 and over say that they often paid by phone. So that's not just sort of as a one-off. Often that's what they're doing. And also, apparently for the first time, cash has fallen below 10% of all payments made now.
Oh, God. See, this does worry me.
Yes. And this is,
It
I
does
think,
worry.
what you should talk about a little bit.
Because on the one hand, I'm like, yeah, I'm one of those people. I hardly ever get my purse out.
Mm-hmm.
And when I do, I go, where did I put that bank card? No idea. So I pay by card on my phone all the time. But then there's just like a little stickiness in me that says we can't give up cash because we've just talked about the cyber criminals. And once everything is digital, everything is vulnerable.
Well, that's it. So obviously the article does talk about sort of the over reliance potentially on
Mm.
digital payment systems and, you know, what would happen if there was a widespread power outage, for example, and suddenly you can't pay by card anywhere.
Mm-hmm.
And also, more and more places don't carry cash and don't allow you to
Yeah.
pay in cash anymore. A lot of coffee shops that I go to all the time, card only. I mean, even the butchers in my local market is card only now. They'll make some exceptions for regular customers, but, you know, and that's just like a little market whole thing. So I do think there's some risks there. And also, the people who are most likely to still be using cash are people who are already more vulnerable or more excluded. So obviously, there was actually in 2023, there was a reduction in the number of people who are using card payments and a growth in people using cash in response to the cost of living crisis, because people find it easier to budget in cash. And that trend has reversed itself now, but it is still many people who fall about at or below the poverty line who are more likely to be using cash for their purchases because it helps you manage your money better. So what does it mean for people who are using it for budgeting, who may have difficulties with accessing smartphones and mobile payments and that sort of thing? So I think that's one element. And also the very many people who are still digitally excluded, who lack the digital skills or the devices to be able to do this. So I think it's interesting. I think it shows a massive shift in the demographics. And if we're thinking about older persons care in particular, if you're sort of thinking anybody over 65 who might be start thinking about care and support and who are increasingly going to be using mobile payments, massive in terms of what that means for the people with support's digital skills. But, there's always that thing about who could be left behind in this.
It's again this widening gap, isn't it? The gap gets ever wider to fill. We saw a story a couple of weeks ago that said, as many as 20% of the UK are living in digital poverty. They are digitally excluded. All we're doing is just shifting them further and further away from ever being able to really catch up.
Yeah, exactly. So, I mean, I know that MPs, I can't remember which subcommittee it was, have actually discussed whether for certain core services or things which are an actual basic human need, that they would discuss mandating whether cash would always have to be an option for people to purchase those services. It's not happening. There are no plans. This is not a big announcement which has come out of conference this week or anything. It's just, something which has been discussed in a variety of sort of parliamentary committees.
Yeah. I think it's an interesting one. And again, when I use it because it's the easiest thing for me.
Oh, definitely.
And I'm always conscious, again, with a cyber head, thinking the less friction there is, the more vulnerable something is. So this just has that sense of it's just a bit too easy.
Yeah. Though, I mean, from a security perspective, the biometrics and multi-factor authentication you have on your phone with payments is much more secure than carrying a debit card with chip and PIN, which up to £100 anybody could just tap. Which is, I think, why we don't have limits on mobile payments contactless, but there are for cards.
Yeah. I did, again, having given it no thought, all I'm thinking is that is just easier to do. And my disposable income bank account shows it.
Maybe I should switch to cash for budgeting.
It's not real money if it comes out of Monzo.
No, fair.
Okay, well, interesting, and probably something that we would like to see an academic study at some point if they want to do a bit more research.
Oh, that would be really good. I do think it also segues quite nicely into the next story that you've picked as well, which
is a big announcement this week.
Huge.
And again, is about this move to a more digital life. So obviously we know it's been political party conference season, so lots of big announcements. This week's been Labour, so we really have seen some big announcements. And one of them was Labour's announcement that there'll be a new NHS hospital online service by 2027, which gave me pause. But essentially what they've said is this is, as with most things with the NHS at the moment, an attempt to cut waiting times, dedicated doctors as part of it. It'll be called NHS Online, which I feel like everything is called NHS Online. So
it's branding, Michelle. Good branding.
But when everything's NHS Online, nothing is NHS Online. But let's not get into that. We'll bring our comms team on to discuss that at a later date. But there'll be a team of dedicated doctors who essentially will take charge of certain patients in this online hospital. And the idea is that they'll do assessments, checkups with consultants and follow-up appointments all online. Now, in one sense, online appointments are becoming, post-COVID certainly, a lot of clinics remains online, or at least with the option for online. But this is an entire system, an entire hospital system. I don't know what the geography of it will be. That will function online. So, it will be accessed via the app. We have already talked about the 10-year plan and the big ambitions for the app. This goes alongside that. What they're going to do initially, which does make me feel a bit better, is choose some of like the lower risk pathways to move over. So I think the ones that they've suggested were ophthalmology, gynecology, and gastro.
Hmm.
So, ones where less life and death in the first instance, but people still have very real health concerns in these areas. There were some questions in the article that I read about, well, how does that then interface with the real world system? We know it's difficult enough for people to go between primary, secondary care, acute, and community. Like we haven't got that seamlessly yet. So, what are the implications for people who are in a partially online system for maybe one treatment pathway, but in a real life one with it attached to a trust for another? Lots of questions. But I do think this is the natural direction of travel for us.
Yeah. I mean, I really like this. And
Hmm.
I appreciate that that's, my demographic. So probably more likely, I like the idea of being able to have a virtual appointment, of not having to travel. I like the idea of being able to do that more conveniently, not
Yeah.
having to take, half a day to travel to a specific clinic for an appointment, which will be 15 to 20 minutes. I like that it would be more empowering to be able to manage certain things myself through an app. So I think if you listen back to our 10-year plan episode, it's pretty clear that I was quite excited about a lot of the developments around the app. I think for many, many people, it'll be really fantastic. I think what we'll need to make sure as more plans about this come out is that for people who have sort of multiple conditions that they're managing, as you mentioned,
Yeah.
Michelle, right? That their views are represented, that for people who do want that face-to-face time with a clinician, that is something which is facilitated for them. People have different sort of, I think, different views about this. Some people would much rather have a face-to-face with an individual, and others like me would be like, oh, you could text it to me.
Yeah.
Honestly, it's fine.
Just WhatsApp me the results. I'm good to go.
Absolutely. Like we could schedule in like a little follow-up, like 15 minutes, like if I have any questions in a
Yeah.
couple of weeks. But yeah. So, as with all things, how it's personalized to individuals is going to be the big question.
Mm.
Obviously, some things around how it's going to be staffed as well. But yeah, I think an exciting announcement and
Yeah.
a concrete timeline.
Well, I know there was a date. That was impressive.
Mm,
I think the other thing for me is obviously with our social care hats on, not having to get residential care care residents to a hospital for an appointment that needs to be staffed and
yes.
accompanied. Very appealing.
Mm-hmm.
Being able to time people's home care visits so that you've got someone. Like there are real opportunities here to improve people's health outcomes who are in receipt of care
Yeah.
if we can tie the systems together so that, we are making sure that appointments for people in social care are also communicated with their care organisation. And this is all about, again, the passing of information between one bit of the system to another, which is, also what is being looked at. But
Yeah.
I do think it's exciting. I think, as with any of these big announcements, it raises more questions than it answers in the first instance, and sometimes that's the point of the announcement, so that people can go, "Oh, have you thought about this?" And they go, "Yeah, yeah, just write that down. Think about that later."
Yeah. Exactly. And that's the thing. We say quite often in this podcast, we'll have to come back to this with more information. And I think that's just going to be one of those. There'll be many rolling conversations here.
Yeah, and hopefully, social care will be part of those conversations.
Exactly. That'd be nice. Novel. um, so my final story I picked this week for the main segment, at least, I'm going to do a caveat. Again, we are not turning into a political podcast. It's just there's been a lot of political announcements recently. So we're going to touch on Brett Card, aren't we?
Yep, we are, and it is going to be a touch. We are going to dip
Mm-hmm.
our toe into the fact that it was talked about.
Exactly. So, for anybody who has somehow missed this, the government has announced that there'll be a new digital ID scheme. And it will be available on people's phones, and it will basically have information about your right to work, potentially to access other services as well, and also link across sort of different government gateways. Um, I think it's quite an interesting one. Obviously, it's something which digital IDs and sort of ID cards have been around as a concept for about 20 odd years. It's been talked about in this country, at least, I think. Maybe going back to the 90s. And, full disclosure, I used to live in both Iceland and in Denmark, both of which are countries which have full requirements to have ID cards in order to live there. You have to have one in order to open a bank account, to access hospital services or any kind of health services, to access any benefits and that sort of thing. So I'm generally sort of more comfortable with them than probably most people, having lived in countries where you have to use them, and, that's fine. The bit which I think is probably interesting around this in terms of social care, why I wanted to talk about it, was going back to that digital exclusion conversation we were having really as a theme of this podcast. Accidentally, that's what's come out. If you have to have a digital ID to be able to access certain services provided by the government, or in order to work, as opposed to, you're demonstrating your national insurance number or your passport or, the current documentation that you need to have. There are a lot of people who don't have access to devices, who we've already discussed.
Yeah.
But there are also people who who have had social workers involved and have had lots of capacity assessments involved and safeguarding assessments involved, who said that they shouldn't have access to smartphones in that way, who may also, though, still be in work and should absolutely be supported to be in work. So again, I think it's one of those things which could accidentally exclude people who we're trying to support into the workforce, when that's very much not the intention of this scheme. So yeah, that was the bit I wanted to talk to, at least about Brickcard.
And I think my initial reaction to something of this scale is, how do we do it and do it safely? And then, I saw a former colleague talking earlier on LinkedIn, and they were saying, well, we've already really taken the first steps with the gov.uk one login. That, and that's been a huge success. That has, in a way that nothing has before, really linked up various different departments so that an individual can travel through, whether it's childcare, HMRC, DWP, whoever they need to talk to, on a single login. So the infrastructure in many ways is being built, that we have probably more capability to do this than we ever have before.
Yeah, absolutely.
So yeah, I want to watch. I have many questions that I know they don't have answers to yet. But it's certainly, I think, a conversation that we as representatives of social care really need to be really clear about what this means for those people that we are looking after in care settings.
Yeah, absolutely. And, I think, as ever, it's sort of what's the unintended consequences of things that happen. And so pointing them out early and often is probably the best way to make sure that they don't happen.
It's the have we thought of that? Is like yours and I specialty at every meeting and consultation we're at. We're like,
social care exists. Hi.
Hi, have you thought about the million people we support? No,
Exactly.
okay.
Have you
Let me
spoken
point
to
it out
them?
to you.
Yeah.
Well, talking of social care having their say, my last story is actually really just point everyone in the direction and ask you to fill it out. The departments have put out a consultation, and is the 10-year health plan workforce plan consultation. So very much in mind the 3 shifts, the hospital to community, the analog to digital, sickness to prevention. What does the 10-year workforce plan need to look like? And they are asking for anyone with relevant, can't speak, with relevant evidence to go on and put their evidence forward for this consultation. So we will, as ever, share the link with you. But let's make sure that social care is really well represented in this, because this is a really important one for us.
Yeah, definitely. Please respond to the consultation. We will be, but we need as many voices as possible.
Absolutely. And with that, we come to mine and your favourite part of the episode, which
Yay.
is our Cyber Squirrels segment. So I think actually today's been quite a positive episode. We've not gotten ourselves too down in the dumps, which sometimes we do by this point. But we have this segment in anyway, and it is for us to talk about a light-hearted, fun, interesting tech story with absolutely no relevance to adult social care. We've yet to find one that does. But yeah, it's just an opportunity for a little story. So Casey, you've got one for us this week.
I have. And given it's Cyber Squirrels, I'm sticking on an animal theme because I have gone on a deep dive about pigeons. Basically, I read this. I know. So I read this article from MIT's Technology Review. Massively recommend that website. Absolutely fascinating stuff on there. I have about 12 pinned tabs at the moment, which when I get second, I will be reading. Something about how they brought in UFO hunters to help to find some drones. Unclear. We'll report back once I've read the article. But anyway, pigeons. So basically, this is an article about a chap called Skinner, who in the 1940s was working in the States. He was American. For the military. And at the same time, people were developing, things like the atomic bomb. Skinner had looked out of his window and saw birds flying in formation. He was like, God, that's a beautiful thing. It's like they're a machine together. And somehow had the bright idea that maybe he could train birds to deliver bombs as payloads. Obviously.
No, you can't. That's beautiful. Let's destroy it.
Yeah. Oh, the story continues. Don't worry. It's going to link to tech eventually, and that is not going to link to the atomic bomb. So he starts off with crows. Crows are too smart to be trained in this way.
Yeah, they are. They're my favourites.
They do not want to do that at all. So his next thought is, okay, well, we need a more docile bird. So he gets the pigeons and basically starts training pigeons by giving them food when they tap at specific places on a map. And the point is that then they could use their beaks to tap on glass to navigate. And that is how somehow, I don't know, I'm imagining strapping bombs to a selection of pigeons somehow. I'm unclear on the details. The article did not go into it, sadly. Though it did have a very funny picture of the little pigeon in its little jacket tapping on the glass. Very cute. Anyway, so obviously this doesn't work. That kind of moves on. Skinner moves on, though, to basically doing basics of animal psychology and behavioral science, and basically had discovered that reinforcement learning is a very good way for training animals based on how they've been teaching pigeons that they get rewarded for doing certain things. This sort of carries on. He's working through to the 60s, falls out of favor from animal behavioralists, which is, again, not an area I know a lot about. But his theories get picked up by computer scientists who are not having much luck with using human-style learning to train algorithms at that time, but start having a lot of success with using reinforcement learning, which had been posited by Skinner, to develop AI models. So that's why, in a very circuitous way, pigeons are responsible for some of how we learn how to train AI models now.
Okay, so the new strapline is AI, almost as clever as a pigeon.
Right? I love these random science stories. I love it when somebody is like, I've got an idea, and then it becomes something completely different and relevant and actually
But you
useful.
also have to understand, for anyone who's worked in any sort of science, he had to write an application form asking for money for this. And then they said, here's some money. Come back when you spend this money. And he said, okay, I found this out. Can I have some more money? And at every point, someone was like, let's keep going with this pigeon thing.
I mean,
we can't get them to study women's health, but they paid for the tiny pigeon jacket.
Hey, they also tried to train dolphin assassins. There was a lot of animal shenanigans happening in the US.
That is an incredible story.
You're welcome. I had to share with you and all of our listeners.
And we almost had an episode with no AI.
I know. Oh my goodness, the pigeons brought it home at the end.
Oh, my word. It's a late AI klaxon for us today.
It is.
Fabulous. Well, thank you so much, Katie. Right.
Yeah, very welcome.
I can't even recover. Come back next week where we will be discussing the latest digital news in care. So, what happens when two plugged-in people team up to demystify digital care? You get to Control plus Care.
Subscribe now wherever you get your podcasts, All of the links mentioned today will be in the show notes.
And tell a colleague, particularly if they never seem to have any cash on them, especially if it's their turn to buy the coffees.